I'm Gene Brusso with TRAZER. TRAZER is a device that objectively measures and assesses human movement. Everything is measured within 3 millimeters, or 1/8 of an inch, and within 1/100th of a second. TRAZER incorporates several different modules. We have senior health that's specific to senior fall prevention, concussion management, which includes a baseline test, as well as a return to play protocol, orthopedic rehabilitation, which incorporates ankle, hip, knee, balance, and vestibular rehabilitation protocols to return to function. Then there are also graded tests, which aid in assessment. We have the graded test 30, graded test 60, and graded test 120. What you do is you start moving at 1 foot per second, and then based on the time frequency, 30 seconds, 60 seconds, or 120 seconds, you increase your speed by 1 foot per second, engaging bumpers that pop up in a random fashion for a period of 5 minutes. You can also modify and create your own assessments. So for this purpose, we have military readiness, which was developed by the Marine Corps Force Fitness instructors. So you're not relegated to the different modules, right? You can develop your own modules based on your own needs. And finally, there are a number of different assessments. With regard to balance, we have the BEST test, which is a balance error scoring system. It incorporates a bilateral, unilateral, and then tandem balance test. That's primarily for athletics and members of the military. And then we have modified balance tests. Balance test 2 is less restrictive than the BEST test and is for the general population. And then balance test 1 is for geriatric population, senior population, or those with severe injuries, or for those that are orienting to prosthetic devices. I'm going to start with the senior health component. So the assessment for the senior health component, the first process is to conduct a baseline test. You select the user, and then you come in to do the baseline test. The baseline incorporates balance, as well as the measurement using the graded test 120. Again, you start out 1 foot per second. After a 2-minute time period, you go up an additional 1 foot per second. And then at the 4-minute mark, you go up an additional foot per second. The senior is moving in a random pattern, which assesses reaction time, acceleration, deceleration, speed, heart rate through telemetry using the Zephyr heart rate monitor or polar heart rate monitor. And then finally, the asymmetry of movement. The next activity is lateral speed, where they move side to side for a period of 30 seconds. That helps isolate the limbs and further identifies the asymmetry in the individual's movement. And linear speed, moving forward and back in the target area to keep the heart rate elevated. And again, heart rate is done through telemetry. Once you have the established baseline,